Good evening, family. This is Found in Translation, and your host, Ray Collazo. Thank you so much for joining us. Thank you so much. Buenas noches, familia. This is Ray Collazo, and you're listening and watching the Found in Translation talk show, the talk show that stacks truth about politics and today's hottest issues. Thank you again so much for joining us. If you're watching this live on Facebook, Twitter, YouTube Live, gracias. There's a lot. Well, I guess there isn't that much anymore you could do on a Thursday night to watch. No basketball, no hockey, but a lot of, card games with the family in the home. Thank you again so much for joining us. Again, there isn't much else to talk about tonight than this incredible pandemic, COVID-19, and we thought it was so important to come on and have this conversation with the Found in Translation community to talk about what's going on, and really provide you some information that you can use not only to be a better advocate for our community to get through this crisis, but also to protect your family. And there's nothing else more important than health and safety of our family. Of course, riding shoddy with me on this journey here in Found in Translation today, co-host Sulaih Picorelli. Sulaih, welcome back to Found in Translation.
Thank you so much for having me back.
So last week we did not scare you off, Sulaih.
No, not at all. What great fun.
I'm telling you, I appreciate it. First of all, Sulaih, let people know how you're doing. This is sort of unprecedented times we're living in right now.
I'm doing better, I'm doing well. Just finding ways to keep busy here at home with the kids. And, I keep asking my kids, do you think that I'm a lunch lady person? A cafeteria person? Because it's like, Mom, breakfast. Mom, it's time for lunch and then dinner. Yeah. So it's been an adjustment. And
it's 10:15, and they've already had
yes.
meals. Yeah, it's interesting because the one thing you learn when you become a parent nowadays with the elementary level kids is like our food schedule. And I guess it was like this when we were kids too. Our normal food schedule is not the kid food schedule. Like sometimes they have lunch early and they're hungry early, or then they've had their snack. It's after school. They don't have the same diet calendar that we do. There's no question about it.
No, it's been an adjustment. And, with having two home, my boys are 7 years apart. I've got a 5-year-old and a 12-year-old. So, taking turns on the computer, doing homework and filling my time with other things. I don't know about you, Ray, but I've been spackling upstairs like a mad woman.
Wow. Don't say that too loud. My wife might hear you. That could be my weekend. How have you been
keeping busy? How have you been, Ray?
I've been good. I mean, I'm working at home. My wife's working at home. Kids are going to school at home. So everybody's at home. And I think the biggest thing for me on a personal level is I do have anxiety personally that people in general are taking this seriously enough. I'll be honest. And we'll talk about that later in the show. So I have an anxiety around that and a concern for sure. And then the other thing is, I'm real blessed. I still got my parents. I still have my siblings and a large extended family, and I'm the sadness I feel is not that it's gonna I know my heart's gonna be a while till I even see them, or you roll the dice at some point if it gets to that point, right? So it's but I'm concerned for them too, because I miss them and I love them, but I don't want to be a danger to them either, tampoco, right? So you go through these emotions, and maybe we'll get into that later in the show. But thank you so much, Sulaih, and you're going to bring a lot to this program. We wanted to first of all, kick off this show by really kind of providing people the 411 on the coronavirus. Later on in the show, we're going to talk to nurses, other health professionals about, kind of how to really protect yourself. People are really on the front lines of care. And then Adonis Banegas from El Concilio, a local nonprofit executive director in Philadelphia, is going to come on. And you and Sulaih are going to help us lead the conversation around kind of the local updates. So in a community like Philadelphia with a large Hispanic community, what are the needs? What are the needs of not only our community residents, but our nonprofits that serve the community residents?
Right.
Because they want to keep their doors open, but they have safety concerns that they also have to manage as well. So there's a lot of issues, and we want to get a lot of information out during this hour. But again, I want to thank everybody for enjoying the Found in Translation show. If you're watching this, please share, especially my Facebook fam or Twitter, YouTube Live watchers. Please comment, and we can incorporate your commentary and your thoughts and your information onto the show. And please share this with your family, because we have to get the biggest thing I'm hearing from our activist class around the country is that we have to get information out there, accurate information to our community. So to begin that conversation, we're so honored to have for my money, one of the leading scientists we have in this country, climate change and health advocates for our whole community, but particularly for the island of Puerto Rico, and the head of Jasperi Consulting, Doctora Frances Colon. Doctora, welcome to Found in Translation.
Thank you so much, Ray. Hi, everybody. I'm so glad to be here.
I know you got a lot of fans watching. Our mutual Comay, Nancy Santiago, was giving you the hands up earlier. So people are very excited to see you on the show. And it's been too long. I think we met in person at an event for the National Puerto Rican Agenda not too long ago. And but you were, your reputation preceded you. So it was great to meet you in person and great to have you on the show. Doctora, let's just start with, can you just help us with where we're at here?
Yeah.
Can you just share with us from your perspective as a scientist, as an activist, as someone that really understands this from many perspectives, just share with our community where we're at here as we're dealing with the coronavirus.
Yeah, so I think the main message I'd like to get across right now is the seriousness of this pandemic. This is a virus that we have no immunity to. Humans have no immunity to. It's highly transmissible. It survives on surfaces for hours and hours. And so because we have never seen this virus before, not only do people lack immunity to it, I had this particular disease before and my body has built up antibodies. And now if I see it again, I can defend myself. Your body can mount an immune response. That's not something our bodies can do right now. We haven't seen this before. And so what you have is an entire population that doesn't have immunity. There's no treatment. We don't yet have a vaccine and won't likely for another year to possibly more than a year from now, which helps a population build immunity to a virus like this. When you are able to vaccinate, which is why we vaccinate our kids to prevent them from getting things that maybe previous generations used to get and suffer from a lot. And today we have those vaccines. And so what we're seeing is that the cases, as the virus is spreading through community spread, meaning from person to person, that it is spreading across the country, we're going to see a spike in cases in the next few weeks. And it'll cause a lot of anxiety. And the reason is that we're finally ramping up in the testing, right? We're finally getting those tests out to the states, to the counties, to the cities, to be able to do the testing, to tell us where we are. And this is crucial. Understanding how many people are infected, who is infected, so that we can isolate the folks that may be transmitting, get folks that are maybe first responders, nurses and doctors that have had it, have recovered, and can go back into the workforce and help the ones that are falling ill. It is very important as we kind of wrap our hands around this crisis to understand who has it, who doesn't have it, and so that we can work on the problem directly. I think the other thing to mention is in terms of the measures that are being implemented around the country, and why you hear so many mayors and governors talking about closing down beaches, for example, where I live here in Florida, and asking businesses to go, restaurants, et cetera, to go to takeout only and delivery. It is to minimize the human-to-human transmission. That's why we're implementing social distances. That is why so many families are staying at home. That is why we need everybody to implement those social distancing practices to minimize the transmission from human to human. It is, again, highly transmissible. It does impact, it seems, from the data we have from China and from Iran and from Italy, it does seem to impact people more severely, the elderly. But more recent data has shown that there are many severe cases in the age group 20 to 49. So none of us are being spared at this point.
No, and I heard in New Jersey that a couple in their 40s and their 5-year-old child just contracted it. So there's no age groups spared. And this is very serious business. And you're listening and watching Dr. Francis Colon, Doctora Francis Colon here on Found in Translation, breaking down the 401 of coronavirus. So, doctor, for those that say, okay, it's a flu, it's not nothing, but at the same time, how can we take this such an extreme measure? Because some are calling for basically a complete shutdown of the country, essentially. And we have that on some levels in some states, depending on the response. What's the answer here? Is it tenable to do that? And is it absolutely necessary? Because what I'm concerned about is that because we don't, we kind of don't like the answer, we're trying to avoid the problem on some level. So What do you say to people that, what should we be doing? I guess is kind of my question. Is this as much of a shutdown as logistically possible the way to go? And what do you see as the next steps?
Right. So let me first answer your first point. This is not the flu, and it is not like the flu. This thing has 10 times the fatality rate of the flu. Human beings already have vaccines for the flu and for the various versions of the flu that come out seasonally. So we have ways of dealing with the flu, even though the flu does hospitalize a lot of people every year, and we do lose thousands of people to the flu. Right now, this is something we have never seen before. So do not believe that this is the flu or like the flu. What we are facing, it's a much graver threat than the flu because we have no immunity to this. And yes, right now, the way to flatten the curve, everybody has heard that term, right? It is how you space out the number of cases along a timeline to allow us more time to ramp up our preparedness in our hospitals, in terms of equipment, building out capacity to deal with this. If all the cases come at us in a steep peak, like we have seen in the curves on TV and everywhere, we won't have the capacity. And that's when hospitals start to collapse in terms of their capacity to deal. It's what's happening in Spain right now, and it happened in Italy. And we're trying to avoid that by implementing these, what may seem very severe social distancing practices across the country, but we need to stop the human-to-human transmission in its tracks. And so we have decided in many places around the country to take an economic hit so that we can deal with the health impacts on our communities.
So, and you're listening and watching to Dr. Francis Colon on Found in Translation, talking about the coronavirus. What else will we be talking about? Including my wife and Pastor Morena have some excellent health questions. We're gonna address those questions when Venessa Rivera, one of our nurses, health professionals, is going to be on later in the show. But excellent questions, keep them coming, and please interact with us on your comment section. Doctor, we're concerned about everybody. And my heart goes out to the beautiful people of Italy and all the people around the world that are dealing with this, but the Italian people, not only in the mainland because of the Northeast corridor, but the country of Italy is going through so much, and our hearts go out to them. Big part of our family, literally and figuratively. But Puerto Rico is also on my mind. Because coño, do we need another one? You talk about a bunch of bad breaks for the island. So in the midst of all this, what are the issues specifically to minimize and mitigate the problem of the coronavirus on the island that we should be thinking about as we mobilize our community to deal with this crisis?
Yeah, well, as little testing as we have seen roll out around the country, around here in the mainland, there's even less testing happening in Puerto Rico proportionally. Even yesterday, the testing capability of Puerto Rico will still appear to be in progress on the CDC website. And so we cannot wrap our arms around this crisis unless we have testing, unless we understand the magnitude of the problem. And we don't have that yet. Puerto Rico has a failing infrastructure in terms of health right now because of the economic crisis that we all know the island has been going through for many years now, and because of the recent hurricane. Puerto Rico is still in rebuild phase. The money hasn't completely flowed into the island to rebuild. Many hospitals and medical institutions were not at full capacity. And now we're faced with this. And so it's very worrisome. Puerto Rico is going to need funding and help to get through this one more crisis. As we know, in January, earthquakes hit the island. So as you know, Puerto Rico's on my mind, it's on your mind, and it's a place that can't catch a break. And here we go once more. And I have to say this, the way I've seen Puerto Rico treated in this crisis, again, like second-class citizens, the federal government is not responding with the speed with which it should to protect its American citizens on the island.
And you're listening to Dr. Francis Colon of Found in Translation. Doctor, stay right there because you're going to be part of our next segment. We want to start bringing on We're so happy and blessed to have Dr. Colon kind of give us a 10,000-foot view of this whole situation. And she brings so much to the table. And we really thank you for all the advocacy that you do for our community. But we want to engage in this conversation, the doers, the people in the community that are really on the first responders addressing this crisis, helping us day to day. Sulaih, Picorelli, transition us into the second segment of Found in Translation.
Absolutely. So you are watching and listening to Ray Collazo, Sulaih Picorelli, and Dr. Francis Colon on Found in Translation Talk Show. Ray and our team stack truth on today's hottest issues like the COVID pandemic. If you are watching live, please leave us a question. Leave us your comments for our experts on Facebook, Twitter, or YouTube Live, and we will read them right on the show. Now back to the host of Found in Translation, Ray.
Thank you so much, Sulaih. Sulaih, what did you learn out of that first segment of the show? Dr. Colon breaking it down, didn't she?
Well, yes, there is so much happening, thinking about the island. And it's worrisome because I saw someone post, I don't know if the entire island is without electricity, but I did see some posts of some people coming through saying, ya se fue la luz. So it's like, how much more do we need to layer, all this trauma that the island has been going through since, 2020 was supposed to be a movie, not a scare.
Yeah, no. And then information, not knowing where the information is coming from, paranoia, just the nature of social media just kind of feeds into the anxiety. Right. So, and thank you so much for co-hosting the show. So, I often say on the program that our heroes don't all wear capes. That's and, right. When it comes to our first responders, whether it's the people that protect us in the military, the police force, our firefighters. But you know what? I always got to give a lot of love to the healthcare workers, mostly women, a lot of Latinas in that group who don't get nearly enough throughout the year, who don't get enough support and attention and appreciation because they really are on the front lines of providing us health in our community. And, in this case, one of my sisters, has stepped up to the plate and is on the front line. So we wanted her to share how it is to be a healthcare worker at this time. And so who better than my sister-in-law, the godmother of my youngest Maxwell, and a nurse, Angie Argentieri. Angie, welcome to Found in Translation.
Hi, Carmen. So nice to meet you.
Nice to meet you.
Yeah, you are, Angie, a little nervous, the technical thing, but Angie, it's easy. It's easy. So thank you so much, Angie. We appreciate you. So Angie, let people know we got people watching all over the country, all over the world. You're a nurse in a hospital on the East Coast.
Yes. And
you are testing people for coronavirus. So just share with people how your week has been.
We usually, I've been a nurse for over 20 years. Lately, I've been doing a lot of management. I'm a manager, and they needed some people to volunteer. And some of my employees, thank God for them, were they volunteered to go up and do this coronavirus testing. And I felt like it was my duty, since my employees were doing it, that I would do it too. And it's been eye-opening. It's been, I'm sorry, I'm going to take off my glasses. It's bothering me. It's been eye-opening. It's been humbling to see all the people that come in and get this test done.
And so can you share with us, are you in a parking lot? Are you in a hospital? Are y'all separated? Paint the picture for us. Are you wearing one of those space outfits? Share with us, what it's looking like for you day to day.
Okay, so I started on Tuesday, and we needed first to get tested so that we were able to put on these, they're called N95 masks, to make sure that we're not able to taste the medication that they put through. So you did get tested for that. So then you go out. At first, we started at a doctor's office. We closed down the office, and we just have people just, getting telehealth visits. And if the doctor says, if they meet the criteria to get tested, they'll send them to our office. But we got shut down. So we're in another area, which is bigger. And it's almost like a drive up, kind of like testing. They call when they're in the parking lot. They say, we're here. They tell us, what car they're in. We get it all set up. We have it running pretty smoothly. We're not touching anything. We get all gowned up. We have 2 masks on.
Wow.
We wear double gloves. We wear capes, basically like a blue gown, sometimes hair nets. And then we go out to the parking lot, or we'll usher them up to the front of the building, and we do the testing right in their car. They actually don't get out of their car. We just kind of test them right there. It's nasal swabs. We test them for the flu, and we test them for the COVID-19.
Now, where you're at, do they have to get a script from a doctor? Do they have to prove that they're sick on some level to get the test?
Yeah. Yes. They had to have a doctor's note. Usually for our doctors, they have Epic. So it comes up on our computer screen.
Oh, okay. So I know Sulaih had a question. She wanted to jump in this conversation. Jump in there, Sulaih.
Angie, so can you speak on what testing looks like?
Yeah, it's very simple. For the flu one, it's a swab in your nose, both.
Yeah.
The COVID testing is actually a little bit more deeper. It's actually a swab that goes a little bit further into the nasal cavity, and it's a 15-second swab. And then we send that out to get testing. On the flu screen, we can actually get results within 10 minutes if they're flu positive or negative, and we can give them that result. We don't have them staying waiting. We'll call them with that result. The result for the COVID testing has been coming back within 3 days, which was a lot better than before because it was about 5 to 7 days. Now there's a faster turnaround.
So once people get their recommendation from their doctor to be tested, do they know where to go?
Yes.
Are they being told by their primary care physician, these are the places where you can get okay, great.
Yep. They get all the information. They get the phone number, they get the information. They tell them once they get to the parking lot to call in, and somebody will answer the phone, take their intake information, like their name, their insurance, all that information, ask them some questions, and then tell them that somebody in a blue suit will come out and usher them up.
Angie, so on average, how many people have you seen since Tuesday? Wow. Wow.
I started on Tuesday. Tuesday we had 50 people. Wednesday we had 64 people. And because we had to change areas today, we couldn't really see anybody until noon. Usually it's 9 to 5. We had to get the other facility up and running with, the computers and moving all our equipment over to this new spot. We didn't start until 12, but we actually saw 60 people today.
Wow. In 5 hours, you tested 60 people.
Yes.
Yeah. I wanted to bring Dr. Colon back in this conversation. Dr. Colon, you're hearing a nurse on the front lines, Angie Argentieri, talking about what she's going through day to day to get people's tested. I know that you're very concerned as a scientist around how we need to support our workers on the front line, our healthcare workers. So what are your thoughts as you listen to Angie's experience this week on the front lines?
I think that this is not something that we can sit around and wait for the federal government to provide us with more, to give us all the information. Right now, we're entering into a phase of this where, as you saw, between yesterday and today, it's starting to enter that exponential phase. And our first responders are going to need equipment to take care of themselves, to be able to take care of people. We need to advocate strongly for the resources that they need, because they are right now our front line. If this is a war with the virus, this is our front line in this battle. We need to advocate for the families that are at home with also no resources. A lot of our families live paycheck to paycheck. A lot of our families have no health insurance. How are we going to protect the people of our country that really don't have the resources to deal with this, that may not have somebody advocating for them to get that test when they may lack insurance, the resources for somebody to be able to pull their family through a period of time where they can't go to work. So we have a lot of communities that will, like usual, it's our frontline communities that are impacted the worst in times of crisis. Whatever crisis we're talking about, it is them. And so I think that our first responders that are most vulnerable right now and who we need the most, we need to focus on protecting them and getting them the resources that they need.
Thank you, Angie. What else? What's your message as a healthcare provider? Just either advice or something you want people to know as a nurse that's on the front lines, taking care of people in a real stressful time.
Please don't take this like a joke. This isn't a joke. I unfortunately had to stop off at the supermarket yesterday to grab some, stuff, and Walmart for things that I couldn't buy at the supermarket. And just a number of people that were just walking in there with their children. And this is not like a single mom walking in or a single dad walking in. I'm talking about, mom, dad, all these adults walking in with these little children into like Walmart. This is a time where these children should be home. And, if you need to go, to the supermarket, you need to get certain things, little contact as possible in and out. This is not the time to be shopping for clothes. And I agree with Dr. Colon on everything she said. We are trying to contain it. We're trying to slow it down. So we're trying to slow down the spread. And in order for us to do that, we have to, stay in our homes so that way we can test the people that are having symptoms, and treat them. And that way, it's not that we want to cure everything and if you get it, you die from it. It's just we're trying to slow down, the progression of this disease so that we're able to treat it properly. And I don't see that people are taking it as serious as they should. And,
no question. Yeah, no question about it.
I'm humbled by the people that actually do come and get tested, and they feel as though that they're inconveniencing me or poor me for being there, testing them. And I say, I volunteer to do this. This is a volunteer, and I'm grateful that I'm able to do this testing for them, because they're appreciative for the people that come in with these symptoms, and hopefully they'll get the results that they need. But they just need to stay home, quarantine. And I know that some people have some questions about, well, if I'm getting tested, how about if my family member is with me? I say treat it as though everybody has it in their home, basically, until you get the results, which sometimes takes 3 to 5 days. Until you get the results, everybody should be treated in the home as if they had it until you get word otherwise that you don't.
No question. Well, sister-in-law, sis, appreciate you. Thank you so much. And we appreciate your service. We've always honored your leadership in the healthcare industry, and your leadership as a godmother to Max. So thank you so much. Stay safe. Get some rest. You got a long days ahead. So that was Carmen Argentieri. We call her Angie in the hood. My sister-in-law and healthcare professional. Dr. Colon, as we wrap up this segment, I need some final words from you in terms of, just what we need to do as activists. Put your activist on hat, because there's going to be a lot of negotiating taking place in Washington. There's going to be package 2, package 3. They're talking about writing us a check. They're talking about, a lot of different, there's lots of questions we even have amongst ourselves around, can you get a free health? Can you get a test everywhere? What if you don't have health insurance? What if you have poor health insurance? So just as activists, what do we need to do to make sure that the most vulnerable amongst us, those are the people I'm so concerned about in Puerto Rico, the immigrant population, are people incarcerated, just our poor folks who are just living by a thread here. What do we need to do to help them as advocates in during this process?
Yeah. Well, the list is long, because, as you know, our most vulnerable have been disregarded for a really long time in terms of a lot of human rights. And so let's start by asking that not only the testing be covered, but the treatment. Once you test positive and you have to be hospitalized and you're on a ventilator, and what we're seeing is people are in hospitals for for days. And when they come out, they're still receiving oxygen, even when at home. It's a disease that dramatically affects the lungs. We need to, as we're negotiating for economic packages, we need to keep in mind, this isn't a bailout for the corporate sector that we hope one day will trickle down. This has to be something that really helps our communities. And so what are we asking for? We're asking for not only a one-time check and we're out of your hair. No, if this is going to take weeks, they need to have a long-term plan. We can't have an unemployment system that's collapsing as people are starting to try to get online to request benefits that they've already paid into for many years. We've worked really hard. This is the moment where we need the system to respond and take care of us. This is why our social safety nets are there for times of crisis and when we're in need. And this is what our communities need. In terms of Puerto Rico, making sure that Puerto Rico is not left out of these packages. For many of the bills passed in Congress, Puerto Rico doesn't fit into the definition of a state. And so many of these health benefits and economic benefits packages don't apply to the island. Making sure that the committee members that have Puerto Rico in mind, that understand how Puerto Rico will be treated in each of these economic packages so that our people are not left behind and not treated like.
Can I just put a point on that? So if there's going to be a lot of bills and a lot of things you're going to hear about that are rumor, then there's negotiating, then you hear there's one version, one person's got. So there's a couple things the doctor just pointed out. So if and when there is a sort of payout, there's no assumption. It would have to be written into the bill that specifically people on the island would receive that benefit. If there's an increase in food stamps or any of these other social programs that could be augmented or included or added or, there's no assumption that people on the island get it unless we advocate for it. And as our colleague, Nancy Santiago, has been pushing on social media, we have to make sure that those provisions are in the bill. So I have a special call from my family in Florida. You have two senators there. Both proclaim the love Puerto Ricans. Mm-hmm. Rubio se va mucho a Puerto Rico. Scott goes to Puerto Rico. Pulse nightclub. They're there for the pictures.
Yeah.
So are they going to be there right now? And you don't have to be Puerto Rican. My Florida people, it's very important you reach out to those two senators because they're going to be critical factors as to whether or not those provisions are going to be in these bills.
Blow up their phone lines.
Absolutely. And look, you could do it as a friendly way. Look, keep it real. If you support these guys, fine, even better. Call them and remind them that you supported them. Because this is not what we need them. Not just for little sound bites and Rubio speaking his little Spanish on Telemundo when he goes to San Juan. That's nice, but that's not what's important. This is what's important.
Absolutely.
Dr. Francis Colon, you're going to come back, my friend. Thank you so much. I'm so proud of you. We didn't even get to we'll get it. My friends, she just wrote an op-ed on this issue in Scientific American magazine. We encourage you to check that out. And so she is one of the most thought leaders, not just among the Latino community, amongst the emerging science community in our country. So, mi gracias, mija. Thank you for your leadership.
Gracias, Thank you. Thanks.
All right. And that was, I'll tell you, Sulaih, we bring the scientists to the building. You know what I'm saying?
We sure do.
Come on. I mean, it's always the same thing with the shows. Like, where do you find these people? I didn't even know these people existed. I'm like, well, it's amazing what Twitter you can find. But anyway, again, a shout out to Nancy Santiago, a great mutual friend of me and Dr. The good doctor that brought up, who kicked off our friendship several years ago. So Sulaih, intro the next segment because there's a lot of questions. I feel like Dr. Phil right now. Because or Dr. Oz, because there's a lot of questions in the chat about what kind of cleaning products I should have. Should I use wet napkins or dry napkins? There's a lot of questions. And we're going to bring another health professional onto the show, Venessa Rivera, for the next segment, who's going to try to answer some of these questions. It's there's a lot of interest in how do we protect our families. That's what we're going to focus on the next segment of Found in Translation.
Just want to remind everyone that you can subscribe to Found in Translation Talk Show anywhere you download your podcasts. So subscribe on iTunes, Radio Public, Pandora, even Spotify. And if you love our content and love the quality that we bring to you, we ask if you can please submit a review and give us a 5-star review that will help us spread the FIT message with Ray and his amazing team of commentators. You can also listen to Found in Translation on WPPM 106.5 FM in Philadelphia on Tuesdays at 11 a.m. Now back to our host.
Thank you so much, Sulaih. A lot going on here, and we have 2 guests in the queue that we want to get into the conversation. The last thing is, though, fam, I know y'all appreciate it. And you're like, why are we grinding? That little TV appearance I had a few weeks ago, talk about coronavirus ruining a television career. My God, I got invited once, they canceled it. Coronavirus messing up all kind of game here. But the bottom line is that if you want to help us spread the message of the show, and we really want to grow, spread this message, because obviously we want a bigger audience for obvious reasons. But, a lot of people need this information. And, these are the kind of leaders that, there's only so many television programs and there's always so many spots, but there's a lot of information that our folks need. And so we'd like to, that is the purpose and the platform of Found in Translation, because we really are able to provide you the information and do it in a way that really is relatable to our community, in a way that you can pass it along. So to that point, when I think about our nurses, our health professionals, our health advocates that can really break it down into really the people on the front lines of sharing the do's and don'ts of how to deal with this crisis, there's only one person that comes to my mind. One of our great health advocates and nurse represented for the Tampa Bay area. They had some good news yesterday, I believe. Venessa Rivera. Vanessa, welcome to Found.
Hi.
Welcome back to Found Translation.
Thank you. Hi, how are you doing?
So, yes, we'll get into Tom Brady. He may get a burnt pan down in Tampa, but that's another story for another time. Venessa Rivera, you're a nurse advocate. I mean, you are one of our ride or dies here, always for the community. I mean, just your opening statement. I mean, all the big thing, and this is why I wanted to have you on the show, Venessa, because our people they are cleaning. They don't even know what they're cleaning. They're worried about their kids. They're worried about their elderly. They're worried about how this spreads. There's so many scientific questions on the chat. So just start with, what's the first thing? If I'm at home, if I'm stuck, I'm with these kids. Yeah. Should I never let them go out the house? Should I let them go in the yard? Should they go see Abuela once a week? Would that get her sick? I mean, just start with what are the basic things that you want people to know as it relates to keeping them protected during this crisis?
Definitely. So thank you so much for having me. And I think first I want to send the message that we are going to get through this. I've talked to a lot of friends and family that are extremely nervous, and we have to use wisdom and knowledge. That's the most important part. We also, and I see Mark is bringing up some really good points. CDC, we need to go to reliable places. So CDC, World Health Organization, look at your local Department of Health. They have great recommendations. But really, it's what our mothers always taught us, right? You touch something, you have to wash your hands. This is how things are being transmitted, respiratory droplets, or somebody's within very close distance. So that's why we talk about social distancing, being more than 6 feet away from each other. Wash your hands. And this means vigorous rubbing, right? 20 seconds, we're rubbing. We're not, doing that little, just, running water through it. We need to vigorously rub, clean our nails, and so forth. Very basic. I know a lot of people have bought out the hand sanitizer, but we can go back to good old hand washing techniques. Social distancing, cleaning in the house. Our Latina moms, I know they're super happy right now because I know I had one growing up, cleaning every part of the house.
I'll tell you, the one stock thing dropping is Fabuloso. That's the stock that you're not going to lose any money on that one, my friend.
That's right. Fabuloso, unfortunately, does not have bleach. Nothing against them. It'll smell nice, but definitely CDC is recommending bleach or 70% alcohol. So your bleach products is what's going to clean it. Make sure when you are wiping them down, let them air dry. You're looking at your faucets, your handles, anything that you're touching. If you have to go out, assume everything is dirty. You touch something, your hand is dirty. You must wash it. Use hand sanitizer. So very practical things. If you have to go to work, and if there are any small business owners here, if you are able to let people work from home, it's a wise thing to do. I know not everybody's able to do that. So make sure that same thing, social distancing, wipe down counters, staplers, everything, the copier, make sure that you have that wiped down on a regular basis. You could even have teams of who's going to do it, use gloves, wipe wipe around the office. If anybody's sick, send them home. Because you don't know. It could be the flu, it could be coronavirus, it could be a cold, but you don't want to expose your employees.
Let me tell you something. 2 people that I know, I just found out today have contracted it around the country. What I'm saying is there's no demographic. It's just people 50 above or people that were on planes. I mean, there is no, and I have people that have been sick that are waiting for their test. So there could be just in my own personal network, 3 to 4 people. I mean, I just saw another NBA star. I mean, just we've been talking 3 professional athletes have contracted. So this is this permeating all levels of society. You don't have to be rich, poor, any color, any race, this is impacting everybody. Sulaih, I know as a mother, you had some questions for Venessa because we are so concerned around not only obviously keeping the house clean, and we're kind of making light of that in a sense, but because the Latinas are on it, they are going to make sure nobody's going to get sick in their house. But I know we're real concerned about our loved ones. And how do we protect them as mothers and as parents? And I know you had a few questions for Venessa.
Well, Venessa, I don't know if you heard at the top of the hour, I have 2 kids. I've got a 12-year-old and a 5-year-old. And for us here at home, it's like, how do I differentiate this information so that it's digestible for my 5-year-old and my 12-year-old understands it as well? One of the things that I did yesterday was, I don't know if you've seen on social media, this, the pepper in the water, the pepper being the COVID. And we did that at home just so that the kids understand, the importance of cleanliness. But how do we support our kids through this crisis, and how do we keep them clean and healthy?
Definitely. And I think it is a very scary time. It's a scary time for adults. It's a scary time for kids. And just explaining to them that, yes, there's something that's going around, and this is how we protect ourselves. So it's wonderful what you did with your children, explain to them the importance of washing their hands, and not to put fear, but actually just support them. This is how we're going to stay safe, and we're going to make sure, and things will eventually go back to normal. This is a transition because I know a lot of children are now being homeschooled, and everybody's going stir crazy. I know in my house they're going stir crazy. So just, encouraging them, being positive about it, sharing, but don't keep the news on all the time. Try to let kids be kids. Certainly they can go in the backyard, they can play, talk to family. If you're not able to see family, use Skype, FaceTime, all the different tools that we have in technology, use those so you can still share, because it's also scary for our seniors, people who may be isolated, and just for somebody to actually check in on them.
And Venessa, now that you mentioned this, this just reminds me of this time that we're living in right now is really going to show what is our heart made of. Yes. I called my neighbor today who's in her 90s. Her kids don't live near, as close as, so, it's like reaching out to the neighbor, your most vulnerable people around who may need some sustenance, who may need your support. Absolutely. So I think we're all going to be, we're all being tested, humanity is being tested currently. And how do we show up for one another?
That's right. And I think we just have to advocate, inform. Please do not spread any false information. I cannot say it enough. Look at the CDC, World Health Organization, Department of Health. I've seen a lot of things on social media where they think that they're informing our communities, where the virus can die if you stay in the sun, or you can gargle it away. Please, in particular in our communities where, we really are trying to put efforts forth to get accurate information. Let's get that good information out there. Ray, I did want to address the question if somebody did not have a primary care provider about getting tested. Please contact your Department of Health, because they actually have very specific criteria. And depending on whether you meet the criteria or not, they may be able to test you. Or
would that be your state Department of Health in your state?
Yes, your Department of Health. So every county has a Department of Health. Even your rural counties have Department of Health. If they're not testing, they will know who is actually testing. They'll know who's providing free screening and so forth.
Can I just add to that? If I could just add to that one of the challenges here, and we're not talking a lot of politics today, but because obviously of the management question, traditional management here, is that there's the states, and particularly governors and state offices, and even cities, the bigger cities, have had to kind of create some of their own rules around access to, information, what's open, what's closed. So I know, Sulaih, you had an update. I believe Pennsylvania's basically on lockdown, starting at 8 o'clock today.
That's right.
Is that, that we really have to look for accurate information, but some of it is localized. So, oftentimes you're going to have to reach out to your state, sometimes even your city departments, but particularly state governments, to answer some of those questions. And you're listening and watching to healthcare advocate and nurse Venessa Rivera, who's joining us from the Tampa Bay area. Again, we have such I would say this, Sulaih, that essentially Venessa and her husband Julio are essentially the I'm gonna make it official right now. The official Central Florida Found in Translation ambassadors. There's no question.
Okay.
They're such huge supporters of everything we do, and that whole corridor there is so important to us for lots of reasons. We want to make sure our people in La Florida, including all of our family. Yo tengo una tía que vive en el área de Tampa, Sonia Rosado, actually a German titi of mine. Long story, but is still there as a senior citizen. So we have a lot of family in that area, and so let's bring on. We want to continue the conversation with Venessa, but we wanted to also engage as part of this information sharing someone that's on the front lines of servicing our community from a nonprofit perspective. And I know that a lot of Philadelphia audience here that's concerned about what's going on in North Philly with our Latino community, our vulnerable population. And not only how do we service the people on the front lines of social services, but they have to protect themselves too. So really happy to have someone that as I affectionately say, one of my young boys, the executive director of El Concilio in Philadelphia, Adonis Banegas. Adonis, welcome to Found in Translation.
Good evening. Thank you for having me. Appreciate it. And yeah, I guess I'll always be one of your young boys, huh?
It makes me feel young to say that, my friend, because if I have a young boy, that means, it's all relative. Adonis,
you've been around for a while.
As the executive director of Concilio, a nonprofit organization in Philadelphia. I mean, you're on the front lines of it. So just share with people, what's the climate of the barrio and some of the challenges that our nonprofits are having servicing our community in this climate.
So when information first came out, obviously we started strategizing internally to identify what we were going to do as an agency. So as of last week, we were planning on modifying our schedule and making sure that we were going to stay in touch with our families as best we could. But then, of course, late towards the end of last week, it was determined that a lot of non-essential locations needed to close down. So we decided in the best interest that we were going to shut down as an agency. And now, of course, everybody shut down. So we've closed our offices as of March 16th and have a schedule to reopen by the end of March. But we've been able to establish our staff to work remotely, which is one of the benefits of having all this great technology. So we're still offering services to our community as best as we can. And, communication has been one of the biggest things that we've been able to navigate through during this time, staying in touch with our families. Concilio offers after-school programming. Unfortunately, because of the schools that are closed, those programs are halted. But with our foster care programs that we offer, we're still in constant communication with our parents just to make sure that they're doing okay, checking in on them via cell phone, via text messages, and if they have the capability via Skype, just to make sure that they have all the needed services. The other programs that we have is victims witness services. And as you know, earlier this week, the courts closed. So that may give false information that those level of programmings are also closed. But the fact remains is if somebody has been victimized of a crime, our services are still available for us to navigate them through the process.
If I could just jump in there, Adonis,
Yep.
that is such a big issue and there's a lot of wrinkles to that situation because the Speaker of the House, Nancy Pelosi's daughter, I think it's Christine Pelosi, has been putting out a lot of information to raise awareness around there are women or there are partners that are basically being quarantined or being isolated with their abuser. And so how do you handle those kind of situations? So these scenarios create other social service issues. So what are you seeing out there, Adonis, that is coming up that's important for people to, what are the kind of issues that in the community people are bringing to Concilio that you think are important for people to know out there that are watching the show?
Yeah, those particular offices within the court are still operating. So if there is a domestic violence issue, they can still follow up with that accordingly. And in terms of just the level of services that we offer, we're here to provide that extra support, that guidance, that navigation through the social system. Even though some of those pieces are closed at this moment, there's still a lot of just navigating and support that could be happening during this tough time.
Okay. I want to get Vanessa back in this conversation. Vanessa, you're talking to a lot of people. You're servicing people. You've done a lot of work with the people that have relocated from the island the last few years through these various crises, right? And tragic natural disasters. What are you hearing in the community? What information do people need to deal with this issue, whether it's healthcare access, social services? Because that's the other challenge, is that the other services, the other needs don't stop. So whether they're healthcare or social service, so what are the things that you're supporting people in the Tampa area at this point?
Right now, it's mainly just helping people navigate, knowing where to go at this point. It's kind of curious. It's like things are very quiet, and that's the big focus. Everything else, I think people are just trying to figure out what's happening. And right here where we are, we have in our particular area, our kids are in the house until April 15th. So even just trying to deal with that, what do families do that have to go to work? They don't have the luxury of being able to work from home. So helping more, just getting information out at this point, but really trying to encourage employers to be a little bit more flexible. It is difficult, when people, that's all their employers cannot let them work from home, and they're trying to figure out, what do I do? Who watches my kid? Daycares are closing. So just really trying to get information out, what resources are available.
No, absolutely. And Adonis, information is such a big part of this, and culturally competent information is such a big part of this equation. Adonis, can you share, you and along with other nonprofit leaders have been calling on the local government to provide more information in Spanish language. There was actually a letter to call on Mayor Jim Kenney to make sure he has not only just Latinos there that can answer a question with the Spanish media, but an official Spanish language spokesperson, because the city, I think, generally has done a good job of getting information out, but there has been that little gap, but it's an important gap. So can you talk about the advocacy y'all are doing to make sure we get Spanish language information out to the community?
Absolutely. With how quickly everything turned around, it was important that our voice wasn't left behind, and Will Gonzalez from SEBA did an amazing job of just continuing to coordinate all the Latino leaders in the community and making sure that our voices collectively were heard regarding that lack of communication that was happening. So while the city as a whole was doing a great job giving that daily update at noon, just letting everybody know, there was still a lot of misinformation that was going on because it wasn't being translated in Spanish. So fortunately, that letter went out earlier this week, and we saw almost an immediate response after that. We started getting communication in Spanish. We started getting the text messages to the COVID-19 app in Spanish, as well as the updates through websites such as the social media outlets in Spanish. So even though the information is coming quickly and some of the stuff still gets missed, it's much better progress than it was earlier in the week. And of course, with more time, I'm sure that this is going to get better.
No, and a lot of people are pitching in, whether it's our friends at WPPM, where we do the radio show, Vanessa Maria Graber, who's doing daily updates, and she's been really harping on this issue of getting accurate Spanish language information to our community. MS Restrepo, local journalist, who also is a big part of that message for the Philly Boricua group, who's been servicing the displaced Puerto Rican community post-earthquake and post-natural disasters. So I want to bring Sulaih back into this conversation. Sulaih, as a Philly resident, what do you hear? What are the streets talking about? I mean, I know some of the issues Adonis is talking about are resonating. So what are people talking about, and what's the kind of information that people would be helpful to people as we go through this process?
I think that right now, the main concern is we're talking about the kids. And of course, I have two kids in the Philly school district who will be home, I suspect, for longer than it's being talked about. I don't know if you saw today that the Secretary Rivera, Secretary of Education, canceled testing, the PSSAs, PASA, and all of that.
It's the school year goodbye. I mean, I hate to say it that way, but I mean, that's just the reality of it. It's going to be difficult for them to go back.
Yeah, we are really facing, what is this going to look like after this is over?
That's right.
Well, to that other point too, they just discontinued the opportunity for kids to have the online education that was going on because certain schools were having it and other schools weren't. So I guess to kind of have a level playing field, they discontinued teachers educating online moving forward.
And actually, Vanessa, I'm going to have you answer Pastor Marena's question in a second, but I want to. Adonis just brought up a good point, which brings up the bigger point here, is that this issue, if there's a blessing in disguise, and there isn't, right? But if there's a silver lining here, is that this issue, this crisis is more than an issue. Mm-hmm. This pandemic is really bringing to the fore all of the social inequities we have in our society.
That's right.
Because now it's like we're advocating for paid sick leave. Well, why don't people have paid sick? Why is there an inequity? Keep it real. Where my children live, they got Chromebooks. They were given Chromebooks.
That's right.
And they have their online assignments. I mean, I know that most of our kids are not getting that kind of support, and they're getting that kind of. And what's also happening is that the well-intentioned parents are basically having to pick up the slack, and we're all doing it. But if you don't even have like assignments, or you don't even have that online support from the teachers or that kind of system, you're working from home and you're a teacher full time with your kid. So it's bringing up all these inequities in our healthcare system, education system, and it's something that is really spotlighting some real sore spots. Sulaih, you wanted to jump in there.
Adonis, I just I haven't heard about that. I guess my experience is with the charter school education and not necessarily with the public. Is it the school district of Philadelphia that's canceled home classes?
Yes. So I believe as of today, and from personal experience, my daughters have been working from home diligently. And they were really like, yeah, my teacher can no longer get back on to answer this question moving forward. So, they have the luxury of having laptops. But I think about another charter school that I'm aboard on at Deep Roots in North Philly, right on Frankfurt Avenue. And those teachers were printing out thousands and thousands and thousands of pages to have those paper work plans for the students to work on. And they were going to be there as an outlet to reach out to them if they needed anything. And now they're not going to have that opportunity to do so. So they're on their own.
Pastor Morena says, indeed, our Latino children fall back during the summer. No reading programs, less opportunities. Now they'll fall back even further, missing the spring semester. Venessa, as a parent, anything you wanted to share about how the Florida education system's handling this situation?
So our governor did close schools until April 15th, physically close them. This afternoon, I did receive a call that our particular district, they're on spring break right now in our area, but our district will be opening with virtual school next week. My kids, it was a mixed reaction there, but I thought that it was very interesting that they did ask, or they will be sending out information for children who do not have laptops to provide it to them. So I thought that was extremely reasonable and something that was absolutely needed. Additionally, the head of agriculture has opened different schools, different sites for children who rely on free and low and reduced lunch, the breakfast and lunch. So they will be receiving breakfast and lunch for children who need that throughout the state. And that was a big concern as well. What was going to happen to the kids who didn't have, that's where they were getting their meals from. Florida is trying.
Our sister Donna McIntyre gives us a shout out, Venessa. Hi, guys. Our homegirl out in Tucson. So what a great friend, another sister of ours. Adonis, one of the things that I know is part of our network, we're going to be advocating for as part of these next stimulus packages, crises packages, is the cruise lines are going to get money, bail them out. The airlines are going to get a bailout. Big restaurants are going to get a bailout. But we got to make sure that we have resources for our NGOs, our nonprofit organizations, so y'all can stay afloat. So just any thoughts around, the business impact in a sense. You got employees, you got to make payroll. You're a hub of economic development in our community. So just a thought about how we need to also advocate for our nonprofit social service agencies during this time period too.
Yeah, no, it's a very trying time. Like right now we're piecing it together. We have a 2-week plan right now. And after that, we're working on what's going to happen 2 weeks later. Our funders are in constant communication with us. So their information is coming in slowly but surely too. And a lot of our programs are performance-based or fee-for-service. So if we're not producing anything, like, for example, being in the after-school program, having our kids being educated, then we're not getting paid. And that translates to our staff not getting their pay.
That's
and
real right there.
That impacts our whole budget. So we are, looking at that and making sure that we're being as frugal as possible right now. But as an agency, the people who work for us are part of that community too. So, and I know that a lot of other nonprofits are doing this right now, that we're making sure that if staff can work remotely, we're going to continue to pay them as much as we can. But we have to be thinking about what's going to happen 2 weeks after this and how we're going to navigate that. The one good thing I will say is that there was a press release today about the Philadelphia Foundation making sure that they're going to release some funds for nonprofits. So there will be some support on that end, and I don't know specifics about that yet, but hopefully there's more and more of that corporate giving, knowing that we are dependent on state and city funding, and if that slows down, it's going to be a huge issue for us as a nonprofit.
No, and I mean the impact of that, people just don't. And I mean, this is me and Adonis's business, literally, but people just don't realize. The analogy I bring is that the Latino social service agencies very much serve as, in the same way in the Black community, the Black church serves as a hub of information, hub of services, a trusted messenger, a safe haven, and the impact on our agencies, I mean, could be very significant. And we've seen the good. I mean, think about all the work, Adonis, you all did for Puerto Rico, and how because you had that infrastructure locally, you were able to manage resources and develop a supply line, literally, through the expertise you all had developed with your organizations. Adonis Banegas, the Executive Director of Concilio in Philadelphia. What else would you like to share with our Found in Translation community, whether they're in Philadelphia or around the country, around what we're dealing with, and anything around the organization you wanted to shout out?
Yeah, and I believe some of your guests have mentioned it before, just making sure you're following good information, solid information. We're constantly posting stuff on our social media outlets at Concilio Philly, and they're all from accredited locations, whether it's the CDC or the Department of Health or the City of Philadelphia, just keeping people up to date about what's going on and just making sure that you're translating things as best as possible in English and in Spanish. And we're doing our part to do that. So I just hope and encourage other agencies to make sure that, not all information is being shared through social media. So our staff is following up with our clients as much as possible, text messages and phone calls, and just checking in as best as we can.
Absolutely. Really appreciate you, brother. And Pastor Morena asked about the Puerto Day Parade. Hey, we got some months to deal with that. So I'm sure Adonis will have those announcements in the proper time.
Everything is scheduled as planned for now.
Yeah, schedule as planned. So, yes. So unlike the NBA's playoffs, July, poor Milwaukee Bucks. I mean, talk about the Bucks getting the screw job here. I mean, the only thing everything's set up, and then the only thing could stop you is a pandemic. Not LeBron, not the Sixers, not the Celtics. A pandemic. But anyway, Venessa,
I'm very sorry. You bringing up the Bucks. I have no clue about anything sports.
Greatest season of all times, and you don't get a chance to prove it. But anyway, it's tough. So actually, in your honor as a Milwaukeean, one of these days I'm going to do a show. And I'm going to
we should do a show in Milwaukee.
So that'll happen. Well, if the convention, if ever leaves my house, that'll happen. But,
I have a place.
As Adonis knows, the nerd out level I get with baseball is kind of unhealthy. So one day I'm going to interwove my all-time favorite Brewer players on the show. So that'll be an ode to Sulaih. Vanessa, my wife, had a last question for you, my dear. She wants to keep her babies and I say babies, they're 8 and 10, as healthy as possible. Give us some other preventative tips, because we don't want anyone to get sick around here. So just any other preventative tips, Vanessa, you wanted to share with my wife and the family here.
It's your basics. Like I said, make sure you're washing your hands, you're limiting your exposure, that you're not around people that are sick. If you have to go to the grocery store, I certainly would just send one person in the family rather than a group. Just very practical things.
Really appreciate it. Sulaih, give me any final thoughts around this conversation. I think we brought some people that had some very important information to share with our folks today.
Well, if I may, just try everyone to build a schedule of normalcy during this time. It does have its benefits, decrease anxiety, getting things done, builds healthy habits, learn new skill. All of keeping a schedule will make the time pass more quickly, and it'll regulate sleep. I know that right now we're just kind of living in limbo, but having and keeping to a schedule has definitely helped my family in this time.
Yeah, that's but definitely with the children. That's really important because you've got to give them a sense of normalcy. It's not vacation time, and
No,
for the ones that are
it's
fortunate
not.
enough to kind of still have that structure through some sort of online learning mechanism, even more important. But also to give them the breaks and to give them that structure.
That's right.
And we're struggling with that, trying to make sure that they can safely get outside, get some exercise, and incorporate that because again, you're working and you're teaching at the same time. I don't care how good these online programs are. So we're really double dipping here as parents and activists. Adonis Banegas, Venessa Rivera, my co-host, Sulaih Picorelli. Thank you so much for joining this very important episode of Found in Translation. Folks, I think this is a show for the foreseeable future. We want to dedicate, and this actually came from Sulaih. I want to give her a shout out. Next week is all about the kids. So we had health professionals this week. Next week is all about our teachers. Online, how do we support our children, our psychotherapy experts? So next week, we're really going to focus on how do we support our children through this process from a social perspective, a health perspective, an education perspective. And, look, we have to find these silver linings, and there are blessings in this, right? I mean, spending time with family, reconnecting, getting grounded in what's really important. And making time for the things that are really important in our lives. I know many of us were doing the rosary with Pope Francis at 4:00 today. So I encourage people to reconnect and connect deeper with their spirituality, whatever that is for them. Adonis and Venessa, please keep us posted around how we can uplift what's going on in Philadelphia and the Tampa area. And thank you all so much for joining the Found in Translation program. Continue to support the program. I don't care how you watch, you listen, it's all good. But subscribe, download, share with your family and friends and network. It's very important that the voices of people like Venessa and Adonis, people like Angie and Dr. Colon, who were on earlier, we need to get this information out to our community. These are the trusted voices that we bring to the table on Found in Translation. Stay safe, family. Keep washing them hands. Keep using your stuff, your products, and stay safe, family. All jokes aside. That's wonderful.
Thank you.